Good morning, everybody, and welcome to this morning's second EARMA Digital Sessions. I'm Niall, I'm EARMA's Communications Officer, and I will be the web host for this interesting discussion today. I would just briefly like to explain the format for you so that you can participate, and we encourage you to do so throughout this webinar. On the bottom of the screen there, on the Zoom screen, you'll see a black bar. And on that black bar, there's a section called Q&A, or questions and answers. So in there, you can type in your questions directly to the speakers today. And Nick, your host, and myself, the web host, will be going through the questions, and we'll be able to put them to the speakers who will be concentrating on the presentation. So say hello, participate as fully as you possibly can. And we hope you enjoyed today's EARMA Digital Session. And I would now like to hand you over to our moderator for today, and that is Nick Klassen, and Nick is the Managing Director of EARMA. Take it away, Nick.
Hello, hi everyone. Nice to welcome you to the second digital session. So the second digital session is part of 8 sessions that we have planned for this week and the next week. The next week would of course have been the conference week. We unfortunately, due to the situation, had to postpone it. As I said also yesterday, we are monitoring the situation day by day, week by week, to look how we proceed with all our events. As you know, it's been postponed, the conference, until September, end of September. Today we have Michael Browne and Björn Kull with us for a session opening up the Crowdhelix network and technology platform to respond to the COVID-19 challenge. So that's all about the crisis we are facing here today. And Michael and Björn will be talking a bit more about what they are doing in that regard, how they are using their possibilities, their platform. So mainly the Crowdhelix platform to address this challenge, what they are doing. Michael is a director at Crowdhelix, but you might know him from his work at University College London, where he spent more than 10 years building up an office around research, European research project, and much more than that. Björn is the head of the research office, or the grants office, at Karolinska Institute, and he will be speaking a bit more about his experiences, and also how our community, how the research management and administration community, how they link in, or what's his value, or why he is taking up an engaging role in this challenge and in this platform, and the collaboration with Crowdhelix and Michael. So I remind you again that this is the second session of the digital sessions. We look forward to 6 sessions next week. Of one is specifically for EARMA standing committees, and one will be, and the closing one will be, with Anna Panagopoulos, who is the director of the Joint Research Center at DGRTD on the implementation of Horizon Europe. Now, with that, I would like to give the word to Michael to explain more about the initiative and how he sees all of that. Please go ahead, Michael.
Thanks, Nick. So good morning, everyone. I'll just put my slides up. So thank you, Nick, and thank you, Niall, for arranging today's session, and many thanks for the invite as well. So for those listening, I'm Michael Browne. I'm one of the co-founders, and I'm a director at Crowdhelix. I myself and Björn Kull from the Karolinska Institute will be talking today about a new initiative that we have recently launched at Crowdhelix to try and respond, to try and help to respond to the COVID-19 crisis and challenges that we face. Where what we have done in the last say month and a half, 2 months, is set up a virtual technology cluster, which we call Helixes, specifically dedicated to COVID-19. So what I'll do is first give an overview, very brief overview of what Crowdhelix is, and then an introduction to the COVID-19 Helix, and then I'll be handing it over to Björn to give an overview of their activities in this area and their leadership in the Helix. So, what is Crowdhelix? So, Crowdhelix is a network and a technology platform that connects researchers and companies to collaborate on pioneering projects. So our main focus is on Horizon 2020 and what will soon be Horizon Europe. And the idea behind it is to profile researchers, profile experts, profile businesses, and match them so that their expertise is best aligned in order to respond to projects, to calls for proposals. So we set up the network really as an idea at the back end of Framework 7 in response to the changing landscape of collaborative research in that the European Commission and other funding agencies nationally and internationally are focusing much more on impact and innovation, and the need to create networks that combine researchers with businesses and end users is becoming increasingly important. So we now have at the moment as a network around just over 561 organization members. The network is based in present is in 45 countries, and we have built our own platform, which we can talk about in a bit, which is to help to profile people's expertise and gives people an opportunity to post their needs, which are then matched through the platform. So as we know, Horizon 2020 is the biggest EU research and innovation program. It's open to any organization in the world, and international teams of research organizations and companies can compete for funds to carry out cutting-edge projects. So this slide here is just a quick snapshot of some of our members. So in short, we have three types of member organizations. We have what we define as RTOs. So these are research intensive universities and research organizations. And this would be really the spine of the network. So we have close to 90 RTO members, and some of the logos you will see here on the right hand side of the slide. We have as part of the network a cluster of international corporations. We have around 15 multinational corporations who are members, and the kind of underneath the underbelly of the network is around 400 SMEs from all over Europe. So just to give you an idea of the network's quality, these are some stats here just to give you an overview of how much funding has been secured from Horizon 2020 by our membership. So how is the network structured? So it's structured around communities which we call helixes. And we have at the moment 22 helixes. So these are virtual technology clusters in the areas that you can see here. So from plastics to climate, cyber, manufacturing, and they're kind of aligned very well with the thematic challenges of Horizon 2020 under the societal challenge and industrial leadership pillars. And you can see here at the top left-hand corner, the recently launched Helix on COVID, which we'll talk about in a moment. So the network itself is sort of underpinned by a technology platform. So this is a tool that we have built ourselves to profile organizations, profile the expertise of people within organizations. And what we do is encourage people to use this platform to post needs. So the platform's used in a very targeted way to enable people to look for experts. So we have encouraged our members, if you're a coordinator and you're looking for an expert, or you're looking for a business or an end user, you can use this platform to put forward a call to action, and then the platform itself will then start to generate responses for you. So here are some examples of how this actually works in practice. So on the left-hand side, you can see a call to action from one of our RTO members in Spain called Latat, and they were looking for a company to demonstrate new business models for beverage, and in response to that, Coca-Cola responded, and then that proposal went ahead and was subsequently funded. And then on the right-hand side here, you can see another example, which was issued by a university in Turkey called Sabancı University. And again, at the bottom, you'll see the response to that from a Slovenian migration institute. So the network itself, the platform itself is underpinned by some technology. So we have recently introduced what we call a recommender system. So what that does is it intelligently suggests and recommends potential collaborators. So if you put forward a request for an expert, the platform itself will then suggest who, by using keywords and machine learning techniques, it will suggest potential or recommend potential collaborators. And then at the back end of this process, we have a team within the office who will then help to facilitate these requirements in person. So this is just an overview, the slide of how you can profile your organization. You can assign organizational contacts, you can highlight the organization's experts, specific departments, and you can view and manage colleagues' posts that are being posted on behalf of the organization. So combined with these activities, we also do targeted events. So we normally do between, say, 10 and 15 events per year. And these are always in response to forthcoming calls for proposals. And then what we do is we use the network, the platform, to identify potential experts who are going for forthcoming calls. So this is just a snapshot of some of the events we've done over the last few years. Yep. Okay, so what are we doing now? In response to the COVID-19 challenge. So COVID-19 crisis has clearly brought about an urgent need to respond rapidly. This is a new disease that requires novel and fast approaches to collaborate and innovate on a global scale. And we felt that at Crowdhelix, what we provide in terms of our network and our platform, we may be able to actually help here. So what we did, we decided to do a couple of months ago, was to create a specific helix, a specific community, specifically targeting COVID-19. So we launched this on the platform and across the network. It's a specific community that focuses on COVID-19. And when we look at how the areas that we focus on with COVID-19, it will also link in with other areas, other pre-existing communities like health, digital society, manufacturing. And this slide here just gives a snapshot of the types of activities that we are doing and how the Helix is underpinned. So we're bringing in the platform, so we've created a virtual community. We're using our network by bringing in the organizations who we already have as members and inviting experts from our network to profile themselves in the Helix. We have a dedicated Helix manager. So this is someone specifically targeting and focused on the COVID-19 area. And then we're trying to link these up with funding calls. So these are not just calls focusing solely on Horizon 2020, but these are funding calls on a global scale. So we've teamed up with an organization called Science Business, who have provided us with and maintaining a list of all funding opportunities that are designed specifically for COVID-19 on a global scale. And what we're trying to do is really just create a free, open access, easy to use platform that can connect researchers, innovators, businesses, and match these to funding calls, Horizon 2020, but other areas as well. So when we started the Helix, we spoke to some of our members. We wanted to ensure that it was supported, and we felt that it was very important that it received academic leadership. So the Karolinska Institute and Björn, who will speak in a moment about this, are the effective Helix leaders, and they are co-supported or co-led by KU Leuven. So KU Leuven are the health Helix leaders more broadly, but specifically Karolinska Institute is leading on COVID-19. And here are some of the research organizations who have expressed at a very senior level within their respective organizations that they support this new initiative. So one other thing we have done as well is to team up with existing networks, EARMA, of course, here today, but also infrastructure initiatives. So you'll see the Association of European Level Research Infrastructure Facilities. We have the Central European Research Infrastructure Consortium. There's a knowledge transfer network, a network here based in the UK, and Emerald Publishing, who is a publishing company who has allocated grants specifically targeted towards COVID-19 to prepare publications in these areas. So if it's okay now, I will hand over to Björn to talk a bit about his involvement and the Karolinska Institute's involvement in this initiative.
So hello everyone. So I'm Björn Kull. I'm head of grants office at Karolinska Institutet. And thank you, Michael and Nick, for inviting me to present at this meeting. And also big thanks, Michael, for setting up the Crowdhelix platform and also this initiative for addressing the COVID-19. And we are very honored to take the lead on this. And I think this first slide a little bit describes perhaps why the Karolinska Institutet got this leading position, but perhaps first a more general reflection on how we see it from both the Research Support Office, but also from the Karolinska's leadership. And I think this is clear for everyone that no researcher, no lab or country alone can find solutions to address the coronavirus pandemic alone. I think this is so important to, especially for a single faculty university as Karolinska. We are only in medicine, even though we have quite broad areas covering most topics in medicine. There are so many other competencies and expertise that are needed to address this challenge. So I think this first slide just illustrates a little bit of the research areas that in some way overlaps with the current outbreak, and there are many researchers in these different fields that are very active now, addressing different challenges concerning this outbreak. And in our homepage, there is also a list of all the PIs that are engaged. It's quite easy to find if you want to get in contact with the specific PIs that are working in different fields. These PIs are obviously also possible to get in contact through the COVID-19 Helix platform. Okay, so I think we could go to the next slide. One other reason that KI perhaps are also the natural leader in this Helix is that we were lucky to win 3 large collaborative projects from this emerging COVID-19 in Horizon 2020. So we are coordinating 3 of these projects, 3 of these 18 projects, and there is another project coordinating by Stockholm University that we are also collaborating with now. So it's 4 projects from this Stockholm region. So it's concerning vaccine development, immunotherapy, and neutralizing antibodies. And one other thing that we are mobilizing also, it's the education, obviously, from the university, that we are launching courses to care providers and medical personnel. And this is a request from the National Board of Health in Sweden. Okay, next slide. So this is just to illustrate the life science ecosystem in the Stockholm area. So, and obviously we are a global player. We have a lot of international research collaborations, but perhaps now, very importantly also, how we mobilize in the region. We have now very close collaborations concerning research and other initiatives concerning the outbreak with the Karolinska University Hospital, obviously, but also the Public Health Agency, which is in close premise. We are neighbors here at the campus. But also the 2 other universities, the Royal Institute of Technology, KTH, and the Stockholm University, and that also coordinate one of these Horizon 2020 projects. We have a joint national infrastructure, which is called SciLife Lab, which also coordinates major efforts then mainly in diagnostics, but also in terms of high throughput research in the coronavirus. And I think it's fantastic to see how everyone has, tried to stop what they are actually doing and mobilize all the resources addressing this very challenging situation that we have. So I think what we are, in a way try to generate here from the Karolinska Institute is to very quickly increase the knowledge. I think this is very important because it's a new virus. We don't know so much about it. So we need to increase the knowledge to better understand its effects on humans. And obviously also to increase the knowledge more specifically on the disease, risk factors, prognosis, and in the long run, be able to optimize the choice of new treatments and vaccines and diagnostics and tests. Okay, I think we could go to the next slide. So I think this will be my last one, and I think I was also asked to give a little bit of a perspective what we are doing at the research support or the grants office. So we are very much involved in helping the researcher here because they are now so focused implementing different projects. So, and there is not much time for you know, things that perhaps concerning compliance, ethics. So I think the research support is very important to go align now with the fast track of the research. So what we have done is we have created, obviously this COVID-19 platform is one of these bits and puzzle bits that fits very well into this, but we also have at Karolinska Institute what we call a research hub and resources for researcher. This digital place for our researcher to be able to get access to collaborator and experts is very, very important, obviously, and also a possibility for all other stakeholders, universities, companies, and to get in contact with KI resource experts and researchers. Perhaps a little bit of an internal resource or question is that there is a lot of questions from the researcher in terms of changes in ongoing funding and also new funding opportunities, but also changes in the terms on ongoing projects. So we have collected all this information in one place. That it's, you know, we regularly updates new grant announcement and changes in terms, and also the digital meeting place is an important part of that. Finding together with science business new funding opportunities. So what next slide? I don't know. What's that? I don't. Yes. So, okay. So Michael, perhaps you could speak a little bit about this because I don't have the internal knowledge really bit about the activities that has been ongoing now in the COVID-19 Helix. But I understand it has been quite a lot of activity also from our PI's experience.
Yes, I'd like to shortly intervene, Bjorn, and ask you a small question that came to light yesterday as well. We were discussing sort of how much time people have for research. So in that sense, I'd like to ask you, you shortly mentioned that researchers are very focused on their projects and there's less time for ethics and other things to do the compliance there and to have enough attention for that. I want to shift that question a bit to how do you feel currently that your researchers are able to continue the work and the focused research, while a lot of them, I am supposing, will also be involved in trying to set up distance learning, although in Sweden it might be a bit more relaxed as I understand it. Is there enough attention to the research? One, I suppose for the people who are really can be involved in the COVID challenge, I'm supposing yes. And how for the others? Could you reflect on that for a moment?
Yeah, I don't really. I think everyone is now very focused on trying to address the COVID-19 challenge, but obviously there is a lot of other research that is ongoing. I think what researchers are a little bit worried about that everything doesn't go. The plans perhaps are postponed. People are not able to come into the labs and also collaborators in other countries that has been very difficult to get in contact with. So I think what they are worried about a little bit is how this will, in the long run, affect the implementation of these projects. So what we are trying to do is to have a very transparent and active dialogue with our external funding agencies to get answers about is it possible to have a non-cost extension of some projects, but what happens if I need to report something now and we didn't have the time to do that? And all these kind of questions are obviously something that we have to address from the Research Support Office.
Yeah. Yes, absolutely. A lot of questions on that in relationship to the funding and to the funders. I am supposing that common sense will, in a dialogue, prevail there, and that they will be reasonable in this regard. But we will have to see country per country and at the EU level, of course. I give the word then back to Michael. I think it would be very interesting now to see. We've seen a bit how the platform works, sort of in a theoretical sense, what's behind it, but to make it much more practical and to see what's been going on.
Thank you, Nick, and thank you, Björn. So yeah, just to follow on from Björn's talk. So just to give you an overview of what the Helix looks like and how it has grown over the last 6 to 7 weeks. So at the Helix level, we've had specifically for COVID-19 Helix, we've had Crowdhelix 70 new organizations join from 25 countries across Europe, Asia, North America, and Africa. During that time, we've had more than 40 opportunities posted in the Helix. So this is where people have, there's a need, they have a call to action specifically for COVID, and they have posted that in the Helix, and then we would then try to address that need as best we can by looking across our network and using the technology platform as well. So this, just at the bottom of this slide here is a quote from Daniel Green, who's CEO of an SME in London. So he says that Crowdhelix, it's too hard to find partners through an organically grown network. And the Accurate, so that's the name of the SME, has been trialing devices that treat patients with end-stage liver disease. When research started emerging, that immune reaction in severe cases of COVID-19 bears similarities to end-stage liver disease, Green decided to act. So this was actually taken from an article that was recently published in Nature Index a couple of weeks ago, where it was highlighting the Crowdhelix response or initiative around the COVID-19 Helix. So just to give a couple of examples of what this actually looks like practically, as Nick said. So on the right-hand side here, you'll see like an example of a call to action that was issued by one of the organizations. So they're looking for a drug discovery partnership on COVID. They would then highlight the areas that they're interested in, sub-areas, so medicinal chemistry, small molecules, and high throughput screening. And then they would give an overview of what their actual needs are. And then once that post is made, we would then respond to that by using the recommender engine, and also the back-end team, the staff within the office would facilitate that as well. So this is a couple more examples where we have on the left-hand side a post that was made from, I think, a Ghanaian organization seeking collaborators for EDCP2 call on COVID. And on the right-hand side here, another post where it's offering expertise in point of care molecular diagnostics. So just what's actually been happening over the last month or so is that this community has started to grow. The activities within it have increased, we've now started to see, and we're starting to track and to capture the matches that have been made and try to identify how many of them have led to successful outputs. This will take a little bit of time, of course, because we don't really know. It takes time for matches to turn into positive outcomes, because obviously people will have to collaborate together and put proposals in. But I mean, in terms of activities that we've had back, we've had 40 opportunities posted, more than 300 requests to join the Helix. We've got, within the COVID-19 Helix, more than 70 organizations represented, and this covers more than 25 countries from all over the world. So in terms of what we're doing going forward, what our plans are at Crowdhelix, we will definitely maintain the Helix, position the network and the platform so that it's well placed to respond to future calls and future opportunities, both Horizon Europe and other funding streams as well. We will update and connect experts to global funding calls, and we will align the COVID-19 Helix to, as best we can, align them to activities with up and coming Horizon Europe opportunities. So if you have a look on the bottom right hand side of the screen here, you can see the level of growth that's been happening within the Helix. We are doing our best to match the experts' needs with the best possible collaborators. And one of the things that we will be doing, and we'll be hosting an event later on this year at KU Leuven, who are our Health Helix leaders. We'll be showcasing some of the outputs and successes that have been generated through this initiative. So this slide here, finally, is just a team who are involved in Crowdhelix. And yeah, I'd just like to thank you, Nick, and to everyone else for listening in, and thank you, Bjorn, for your contributions as well. Very happy to answer any questions, should any have come in during this period.
Yes. Thank you, Michael. I'll start with a few questions from my side and answer a few ones that have been put into the questions. We will be releasing the slides and putting also this recorded session onto the internet for you to share with your colleagues or look back at those things that you found of particular interest. Michael, I'd like to go back, for example, to make it very practical, to the liver disease example that you gave. Could you say a little bit more about what happened there? Because you of course, you described it as that they found something, but to just highlight how practical this is, more than just also starting up a funding opportunity. It was here where a project was incentivized to use its outcomes immediately, or to immediately start trying. Could you say a little bit more about that?
Yeah, of course. So this example is based on a company called Yacrit. So they're an SME based in London, and they actually coordinated a number of Horizon 2020 projects, but in the area of liver disease. And what they one of the unexpected outputs from the project was that they were able to create an enhanced approach to ventilation. And they realized when the COVID-19 crisis kicked off that they may be able to pivot that technology to help to address the existing challenges. So what we've done with Yacrit is to connect them to a number of funding sources. This is Horizon 2020 was one of the ones that we looked at, but it didn't match because it would take a little bit too long, and also the calls were not aligned to what the Yacrit wanted to do. But we've linked them into to other private and public funding opportunities, and they're currently in discussions to apply for that. And if they get that funding, then they'll be able to scale up that approach that will hopefully help to get solutions for ventilation to tackle COVID.
We've got two questions here, Michael, and I think you can probably answer them in one go. And it is, how does the university join Crowdhelix? What is the fee, if any? And then I understand that there's a difference now at the moment with the COVID Helix. And the second one, what is the business model of Crowdhelix, which is then also attached to that?
Yeah, no problem. So Crowdhelix is an SME. So we're based in London and in Ireland. Our business model is we're a subscription-based network based on the principle that you pay a membership fee, organizational level. And once you join, you get full access to the platform and to the events that we host. The fee for research organizations currently, if you're from a widening country, is €5,000 per year, and if you're from a non-widening country, it would be €7,000 per year. If what we've done with the COVID-19 Helix, though, is to make that community completely free. So if you're an organization that wants to join that cluster, you feel that you can add value and you want to help, then you can register for free.
Yes, this is also one of the reasons for us for having this session. And as we saw strong leadership there from Grant's office, from Karolinska, and a lot of the members, as you might have noticed, a lot of the members that Crowdhelix has are also long-standing and founding members of EARMA. So we found it very important also, while they've opened up the platform to let our community know, to make sure that they can engage there at this moment. And now it's more addressing the challenge. So they've opened it fully up. So we are happy with that. There is a question on, do you have an indication or even evidence if there's a higher success rate when putting a proposal together with the Crowdhelix platform or a consortia formed in that way?
That's a very tricky thing to track in an accurate way, because there are connections that are made and some go ahead, some don't. What we do ourselves now is we track some connections that have been made that have led to proposals being funded. And we've created a page on our website entitled Success. And I would invite and welcome anyone to have a look at that, and you'll see a long list of outputs and successes, case studies of success that Crowdhelix have enabled over the last couple of years. So what we do is we try to capture one success story per month from a different member to highlight the help that's been provided through the network and the platform that have then generated a success story. But it's very, very difficult to really get an accurate picture on what's the actual success rate, because some proposals go ahead, some don't. Some are directly linked, some are indirectly linked. So that's a really tough one to pinpoint. But what we do have is a sort of a page on our website that does highlight from our membership base that it does work, and there's some real life examples on there.
Yeah, absolutely. This is also the question that research offices are often faced with, or trying to show their value within the organization, and then seeing if there is a higher success rate, which is a very, very difficult and complex thing to do. Certainly appreciate that. There's a specific question on the social sciences. The Helix is also looking. Okay, it's shifted now. The Helix is also looking for researchers from social sciences and humanities. So is there also research going on about important political questions, such as freedom restriction, impact of restrictions on democracy, new forms of racism, and so on?
So one of the things that we have found with the COVID-19 Helix is that it really, whilst it falls under the umbrella of the health Helix, it actually covers all areas of society. So you were looking at public policy, well-being, mental health, economics. So it's really cross-cutting across all of those areas. And I think what we're trying to do is encourage people to go to the Helix that not that it, so that they're not just focusing on the opportunities solely from a health perspective, but from all other cross-cutting areas as well.
Yeah. Okay, somebody is asking for the success stories. Michael, do you have some success stories published on the website, or any particular ones you'd like to share?
Yeah, so if you were to go on our website, there's a tab called Success. There's a whole host of examples of outputs and case studies that have been positive, so from our members, so from all over Europe as well. So these would be research organizations, universities, and businesses as well. So there's probably about between 20 and 30 examples on there that we populate here. We post one success outcome per month.
Okay, super. Thank you, Michael. Björn, is there anything you would like to add that has come up during what Michael has been saying?
Yeah, absolutely. And I think I just want to also say that it's not only value for our researcher, it's also value for the research support office. I think KI has been a member now for little more than 1 year, and it has been a fantastic experience, I would say, from my perspective, increasing my own network, getting to know people in my position in other universities, and the meetings that we had together has been really, really good for me and for my group also. So I think we haven't really seen any large impact yet from KI research perspective, because it's quite new to us and we are learning about it. But I think everyone is on board on this from the KI leadership, that we need to expand our network, especially as a single faculty university. And I think this is an incredible opportunity for us to be engaged in this network. And so we are only seeing the beginning of how we will be engaging in different activities. And it's not only about the funding, it's so much else that this network is contributing to.
Okay, super. Thank you, Björn. I see also a few questions that are quite detail oriented on how to participate, what fees might be in that way. I highly encourage you to get in touch with Crowdhelix directly. I'm sure the people from the team will be able to answer those detailed questions. I move to a question for Björn here. How do you share information in relation to ethics issues for COVID-19 at the grants office? Does the digital meeting place help with this?
Well, we have actually a department at KI that have a lot of research in medical ethics. So we have a close contact with them. From our perspective, from grants office, we're working more with a legal and administrative angle on the ethics, but there are a lot of other research ethics that needs to be addressed. But obviously now, when there is a lot of things that is ongoing, and it has to be very fast, and we have seen tremendous speed of change in how everything is mobilized. And I think you still need ethical permit to do your research. But what we are trying to do is to get to all the hurdles, to speed up the process. And I think the government agency approving ethical permits, they are now, prioritizing applications that concern research in the COVID-19. So I think this is obviously something that we could help to lower the hurdle, but still you need to think about the ethics, and you still need ethical permit, obviously.
Yeah. Okay, super. Thank you, Björn. There are no more questions. I'll leave you a final chance. Anybody who's on the call to type in your final question for Michael or Björn. And in the meanwhile, I'll refer for a moment to the session. Björn, could you please, or Michael, could you stop sharing the screen, please? Okay. Yeah, we have another question. Okay, there's something with the questions here where I'm seeing a couple questions come back that I previously saw. It says something, John Donovan, could you please specify further? You say joining on behalf of an organization. I'm supposing that you mean as a research performing organization, or an RTO member as it's called here, that you would join as an organization. I do believe that's the case. Could you specify further, John? Yes, so I think Michael did answer that, but I bring it back to Michael for a moment. So if people from our community, which are mainly research performing organizations or solely research performing organizations, being universities or research organizations, they would be joining as an organization rather than in any other capacity. You're still muted.
Yes, that's correct, Nick. So it's at the organizational level.
Yeah. So Michael explained in the beginning, for those who might not have been there, indeed, that there's a number of different levels, the large ones being, I understand RTO members, so research and performing organizations, more the academic side of things, you might say, then multinationals and SMEs, which are the main layers. As we have a few minutes less, a very specific one for Michael. There is a longer question here. How might others, other networking organizations that are specifically looking for research partners possibly be included in Crowdhelix? So mainly, how might other, I think, networks and organizations be included while they aren't immediately affiliated to an organization, I suppose? Is there an option for that?
Yes, for sure. So I think the idea behind Crowdhelix is really to make a community as open as possible and accessible to as many appropriate organizations as possible. If a network wants to join, we'd be very happy to speak to them to discuss what that would look like and what their composition and membership looks like, and see if that's possible to bring them in as a representative.
Okay, super. With that, I would like to close the session for today. And I remind you that we have 6 sessions next week. So next week, Monday, we're starting at 10 in the morning. Normally, we always start at 10 in the morning with assessment and its impact on institutional strategy and international comparison, and mainly an international comparison between the UK and Sweden, with speakers being Andrew Jackson from Durham University and Sigrid Urbeck from University of Gothenburg. So that means they'll be looking at assessment indeed. Andrew is the Director of Research and Innovation Services at Durham University, and Sigrid is the head of the Grants and Innovation Office at the University of Gothenburg. So I close by thanking again Michael and Björn for their time. I thank all of you for joining this session, and encourage you also to look further into the sessions we have going on next week, but also a call to action to send to us any ideas you might have around digital presence, around webinars within the frame of EARMA. We are starting this series of digital sessions for the first time, also as a sort of a trial, and seeing how we can build on that and what we could do more, especially as the current situation develops itself, where we'll have much more of a difficult time trying to meet in physical terms. You can do that at www.earma.org. You can get all of the information for the digital sessions and mail us at earma@earma.org or any of the contacts that you already have. Thanks again to all of you, and I hope to see the viewers and participants next Monday or in any of the remaining sessions.